Okay, doctor. In between that only, I'm having means another query come to my mind.
Mhm,
So means speaking of earlier detection, doctor,
mhm.
means how can regular screening help means identifying a cancer before it means became advanced?
So first of all, I mean, um, we need to understand that there are some preventive tests which have been recommended. Recently, United States has a preventive task force called as USPTF. About 2 years ago, they changed their guidelines. They dropped their age of screening from 50 years to 45 years. What that means is that in America, everybody was advised to undergo colon cancer screening, which can be done in different ways. The best test or the gold standard test is called as colonoscopy, which we recommended for every 10 years, starting from age 50, which was dropped recently to 45. So that's one of the tests I will recommend to my fellow Indian brothers and sisters, that if they can, once they are reaching at age of 45, they should definitely talk to their doctor or gastroenterologist about undergoing colon cancer screening. Now, I can understand some concerns about getting colonoscopy because that's an invasive procedure. You have to drink those liquids, have to clean up your bowel, and that's an invasive procedure. If they are not ready to do those kind of tests, they can always go for DNA or stool DNA testing, in which they can send their stool samples, which can detect colon cancer DNA. These tests are also used in America and have been used for a very long time now, and they have been very, very successful.
जी.
Um, these are the two tests which I highly recommend anybody who is over age of 45, and specifically those to the two view to the two person who have asked me a question. I think his name was Rahul, who had a cousin about 35,
Yeah, yeah, Rahul.
from CV. So if they have first blood relative which is 35 years of age, anybody in the family who is at 25 years of age or above should get a colonoscopy. We always recommend, if somebody is diagnosed with colon cancer before the age of 50, the other person or the younger people in the family should get colonoscopy 10 years before that incidence. So if somebody has a cancer at 34 years of age, they didn't get a chance to get colonoscopy because they're not 45 yet. So if they're diagnosed with colon cancer, their brother or their sisters should get colonoscopy starting from age 24. Apart from that, please report whenever you have symptoms such as you are losing weight or having blood in stool. Please do not ignore them. Please go check with your primary care physician doctor, discuss these symptoms with them, and see if these symptoms warrant or necessitate doing a CAT scan or a colonoscopy. Loss of weight, loss of appetite, and having blood in stool are the three most common symptoms which we see with colon cancer patients.
Yeah, doctor.